Welcome again to this third webinar on how to extend social protection to informal workers. This webinar is part of a series of webinars dedicated to topics connected to the informal economy. These webinars are organized by the Research Network and Support Facility. Our project is a European Union funded project to improve knowledge on ways to enhance the livelihoods of people depending on the informal economy. And in our work, we are from one side supporting 15 projects in 14 countries funded by the thematic program of the European Union Investing in People, which has a specific focus on the informal economy. And at the same time, we are also conducting research and trying to identify best practices and information to be shared with practitioners, civil society, organizations, donors, and other experts working in the field. So we decided to share through these webinars key basic information on relevant topics and finding ways to increase social protection for informal workers is a very important part of this effort. At the same time, these webinars are also a sort of introduction to the information, more in-depth information that we have produced through the publication of books. As you will see this at the end of this webinar, we have produced last year a book on social protection that it's available, and you will have the link in order to access and download it. It was part of an effort to gather together ILO experts, civil society organizations, academics at the European Union, and it was organized in Kenya last year. And during 5 days, the participants reflected on how to extend social protection mechanism to informal workers. And the results were then summarized in a book that is now available, and you will access to this. So we can go ahead. I will just briefly introduce our panelists of today. We have Professor Jacques Charme. He's an economist, a statistician, and is the former director of the Institute of Research for Development in Paris, and he is also our research expert. And we have also Jürgen Omen. He's a social protection expert at DEVCO and the unit B3, which is the unit dealing with migration, employment, and inequalities. So I would give the floor to Jacques. Welcome, Jacques. And he is going to present the topic of today. And first of all, to clarify what is social protection and why is it so important talking of social protection when we address the informal economy. Thank you, Jacques.
Thank you, Paolo. So this is the third webinar. We had the first webinar at the beginning for the definition and the assessment of the magnitude, the trends and the components and characteristics of the informal economy. And our second webinar was dedicated to the strategies and policies for tackling the informal economy. And among these strategies, one, and probably the main one, is extending social protection. So this is the topic of today's webinar, informal economy and social protection. So there is a tight link between the two concepts because the informal economy can be roughly defined as covering the population of workers who don't benefit of any social protection or who are not contributing to social protection schemes. Consequently, extending coverage is a key issue for ensuring the transition from the informal to the formal economy as stipulated by the International Labour Conference ILO Recommendation 204 adopted in 2015. This same year, the Agenda 2030 was adopted by the international community, and the social protection coverage and the informal economy transition is referred to in 3 of the SDGs adopted in 2015. First, extending coverage is referred to in SDG 1. Target 1.3 is implementing nationally appropriate social protection system and measures for all. SDG 3 on good health and well-being has a target 3.8 on achieving universal health coverage. And finally, SDG 8 on decent work and economic growth referred to encouraging the formalization of growth of micro, small, and medium-sized enterprises. So what is meant by social protection? There are several components in social protection. The first one is social security, which is statutory and contributory, and covers various types of risks. In fact, this first component refers to the formal sector, public and private. Besides this first component, there is a non-contributory social assistance. Usually, these schemes are means tested and consist in cash transfers or in-kind transfers that are conditional or not conditional and funded through taxation or international aid. A very well-known example of such cash transfers is Bolsa Familia, for instance, in Brazil, which is a conditional cash transfers. It is conditioned to schooling and vaccination of young children. But there are also such cash transfers conditional as oportunidades in Mexico and other ones. In-kind transfers can be illustrated by the BRAC programs in Bangladesh. BRAC is one of the biggest NGO in the world and provides the poor that are targeted by the schemes with small assets such as goats, chicken, or cows, along with weekly allowances of cash or food. The third category of social protection schemes are social safety nets through labor-intensive works, cash for work or food for work. And finally, there are also traditional safety nets, social safety nets, solidarities among populations based on kinship, ethnic, or geographical ties. And among these, remittances are very important, of course. So social protection is covering several risks. And for covering these risks, there are various types of responses and schemes. So the first, the basic one, is illness. So it covers medical expenses, but also loss of income. Because when you are ill, you cannot work, and so there is a loss of income. Maternity also must be covered for medical expenses and loss of income. Family responsibilities, disability, old age, with the contributions for pensions, occupational injury and illness, it's very important for workers also, death, extreme poverty with the social safety nets, guaranteed employment, cash and in-kind transfers, unemployment, of course, with unemployment benefits, and climate, natural disaster, war, and long-term fragility covered by emergency relief. There are several major challenges in extending coverage of social protection. The first one is that the majority of workers in the informal economy are self-employed. And as such, it is very difficult to apply and collect statutory contributions to social protection. Also, informal paid employees in the formal sector or in the households, domestic workers, are not covered or insufficiently covered by social protection, and they have no interest to claim for their rights because they fear to lose their jobs if they claim for their rights. And another challenge is the balance between public or private intervention, or also the intervention of social and solidarity economy as the main tool for extending coverage. In extending coverage, workers in the informal economy are, so to speak, the missing middle. Why? Because they are excluded or they exclude themselves from contributory schemes because of the inadaptation of the tools. And they are excluded as well from social assistance schemes and social safety nets because they are supposed to have a job, and so they can earn their living and are not and cannot be elected for social safety nets. There are, in the world, there are trends toward exclusion. The first one is that budget cuts hit government action. And since many years, urbanization and the rise of individualism have weakened community solidarities. In the field of work and workers, externalization has been on the rise. The putting out of wage workers and their transformation into self-employed and dependent workers has not helped to extend social protection. And in the supply chains, integrated supply chains, subcontractization and casualization of the workforce has also played a role in the exclusion from social protection systems. So why extend social protection? First of all, social protection is a right that is inscribed in the constitutions of many countries. Social protection also benefits to workers. They become and they are healthier, more productive, empowered. But social protection benefits everyone. It avoids disruption and social unrest and promotes social and political stability. And it is not true to say that informal workers are not paying taxes and contribution. In fact, they pay taxes through the value-added tax because they are consumers and they are also as producers, purchasers of goods that are taxed with VAT. So in this sense, they are partners of the social contract in the country. Also, it is each person's interest to spread the risks onto as many other shoulders as possible. And finally, we can say that social protection boosts livelihoods and households' ability to invest and to take productive risks and increases the national economic resilience. It is necessary to scrutinize the legal and institutional framework in a country to understand the various steps that are necessary to extend social protection. So first, it is necessary to identify what exists and what is accessible to informal workers. Existing programs generally focus on the formal part of the economy. So improving or reforming systems depends also on good governance and awareness of the situation of informal workers. So there is a necessity to recognize informal work. There are three main general approaches aiming at universal coverage. An option is to make publicly funded schemes universal. Another option is to design framework laws to cover the whole informal economy, within which sector-specific schemes can be implemented progressively. And another option is to develop piecemeal schemes for each sector, industry by industry, and try to ensure that there are no gaps. Some guiding principles in extending social protection coverage are, of course, to discuss with the stakeholders, that is, the various categories of workers, the employers, the workers' representatives, community leaders, local officials, community organizations and NGOs, and of course the media. Another principle is to provide a minimum level of social protections. We have seen already the list of all risks. Of course, a social protection floor does not intend to cover all these risks. There are priorities. And so the minimum level should include, for instance, health coverage or contribution for pensions, and for some categories of workers, occupational safety and health. And so it is necessary to give priority to short-term needs, but balance with longer-term needs. It is necessary to encourage enterprise to become formal. And for that, there are possible incentives, for instance, amnesties, easy procedures, tax exemptions, etc. Also, it is necessary to provide incentives for workers. For instance, government could match the workers' contribution in order to abound the fund for social protection. Improve technology, enhance transparency and accountability, of course. Improve technology, for instance, introduce smart cards and biometric identification, digitize records, mobile phones for transfers of contributions and for payment of allowances. Improve coordination between contributory and non-contributory programs. And finally, train staff and raise awareness. Regarding the sources of funding, social protection arrangements managed by trade unions, community groups, and other bodies can be added to government-managed schemes. Informal employers can pay fees directly into a social protection fund rather than to have to register each individual worker. Also, a unique tax system based on other criteria than the wage bill can be helpful in order to increase the sources of funding. For instance, in a previous webinar, I have presented the monotax system in Argentina. Small informal entrepreneurs can pay a unique tax. This tax is based on the number of square meters of the workshop or the consumption of electricity, for example, and it is comprised of a part which is for the tax ministry and another part for the social protection system. And finally, higher contributions can be collected for higher benefits or more benefits. So these are the first comments that I have to make about the extension of social protection.
Thank you, Jacques, for your interesting presentation. We have just seen in this first part how much social protection is linked to the informal economy, because social protection, lacking social protection, is one of the main characteristics of informal workers, and this is a situation that exposes them to a lot of risks compared to workers in the informal economy. So after having discussed the challenges of extending social protection and some potential approaches, I would like to ask you, how can we improve the access to social protection? How can we overcome the barriers to accessing social protection for informal workers? Thank you.
Okay, so there are problems with access that can be identified. The first problem is about information. Many informal workers and many poor populations are not aware of their entitlements about social protection. They are not aware of the social protection schemes that exist in the country. The second problem is about affordability. The levels of contribution can be too high. The regularity and periodicity of contribution may be inadapted. The type and quality of benefits may be inadapted. For instance, inappropriate benefits and difficulties in obtaining them, with complaint remaining unaddressed. Time and place are also an issue. Offices for paying contribution or for receiving allowances are remote, and their opening hours are not convenient. There are also problems with the processes, difficulties in registering and contributing, queues, complexities, need of repeated visits, and unfriendly staff. So, in order to improve access, it is necessary to adapt benefits. For instance, it's a good policy to add some short-term benefits that might be included, such as death and funeral assistance, education for children, support for housing, skill building, purchase of equipment for work. Such items, if they are added to the benefits, can enable informal workers to meet their immediate needs and act as incentives to join the scheme and further invest in longer-term benefits. It is possible also to adjust the requirements to make a contribution flexible and affordable. Also, make qualifying conditions more flexible and ease payment procedures. And another possibility of improvement is in making it easier to get the benefits. For instance, the use of two facilities at the same time, near home or near workplace. And smart cards can help for that. It is important to emphasize the role of NGOs and social and solidarity enterprises as intermediaries for extending social protections. They are very useful and important in assessing needs of specific populations. They can help running publicity campaigns. They help raising awareness of informal workers about their rights and helping them navigating across the plethora of schemes, criteria, and procedures. They are also helpful in lobbying governments and employers and documenting the activities. They can act as representatives or intermediaries for groups of informal workers, and they can help informal workers to get the benefits they are entitled to and ensuring quick and efficient disbursement of benefits. They can help informal workers organize their own social protection schemes, and they can help organizing collective registration at marketplaces or elsewhere. And I would like to finish my presentation by mentioning some examples of good practices that are extracted from several reports prepared by the Research and Support Network Facility, RNSF, and especially the book on social protection that has been edited by the network. The first one is Sewa Sakti Kendras that help navigate bureaucracy in India. You know that Sewa is the Self-Employed Women Association in India, the first trade union of independent own-account workers. And Sewa has created these Sakti Kendras, which are empowerment centers that help the informal workers to get their allowances from the various schemes, social protection schemes in India. Another interesting experience and good practice is the one conducted by the AFSI Foundation in Italy that is conducting an EU-funded project in Côte d'Ivoire in support of handicrafts. AFSI has helped creating groups of savings and solidarity community that are some kinds of microfinance institutions with a function of health insurance. On their savings, the workers and the craftsmen and women can decide to activate a part of these savings for an insurance function for health coverage, so that they can abound a mutual fund by professions and a general mutual fund at national level that is helpful in order to give them access to health coverage. In Ghana, there are two good practices that deserves to be mentioned. The first one is about health insurance for Kakaye headload porters in Accra. It is a WIGO action. WIGO for Women in Informal Employment, Globalizing and Organizing is an international network, an NGO. that support this action and many others, and has convinced the official of the National Health Insurance scheme in Ghana to open special drives for registering at subsidized costs near workplaces. And also another EU-funded project in Ghana for support of women shea nuts producers that have been organized in community groups and cooperatives for bundling volumes and improving quality of shea nuts, but also for adhering to the national and health insurance scheme in Ghana. So these are some good practices that you can find in the book that has been recently published by the Research Network and Support Facility. Thank you very much for your attention.
Thank you very much, Jacques. As you said, the book is available on the link that you can see now. You will find in this book a description of characteristics and trends of social protection and the link to the informal economy and the issues in accessing social protection. And also there are 3 chapters dedicated to how to work on legal and institutional framework, how to work on removing the barriers to access, and also a section dedicated to what we call the community-driven support. I mean, how to use those community mutual assistance networks that exist in many countries to support people and to introduce social protection mechanism involving and designed to the needs of informal workers. So thank you again, Jacques. And now we have Mr. Jürgen Omen from DEFCO, the unit B3. He should be connected in a moment. Hi, Jürgen, can you hear me?
I can hear you. Hi, and I hope that everyone can see me. I have to
not really. Maybe you didn't switch on your camera.
I have.
Interesting. Let's maybe switch it off and on again.
Okay, we will try that.
Yeah, now okay. We can see you.
Now Hi. I can see all of you.
Yeah, welcome back. So, as I said, Jürgen is working for Unit B3 as social protection expert. Unit B3 is the unit in DEFCO dealing with migration, employment, inequalities. And today, in his presentation, we're going to see what is the European Union approach to support the extension of social protection to informal workers. So thank you for being with us, and please, here is, I will give you the floor to start your presentation. Thank you.
Thank you very much. First of all, I wanted to thank the organizer for this interesting topic, and also thanks to Jacques for this comprehensive overview that he has provided to this webinar to the whole audience on the topic. I tried to be quick because you took much more time that were allocated to you, Jacques, and I'd like to speed up and will not go through all of my slides prepared so that we have at least a little bit time for discussion. So let's just go to the framework, and I know in previous webinars you have talked about it. The data that I have here collected is from some recent publication, the World Development Report 2019 from the World Bank, the World Social Protection Report from the last year from the ILO, and there is an upcoming publication on tackling vulnerability in the informal economy, which will be published soon by the OECD and which has been developed together with ILO and co-funded by the European Commission. So what is out there? We are talking about 2 billion workers globally, which represents 61% of the global workforce. A very large proportion with more than 70% in sub-Saharan Africa, 60 in South Asia, 50 in Latin America. And if we look at the breakdown a little bit different, we see it's more than 90% in agriculture, 60% in the industry, 75% of youth and older workers, and in low-income countries, it concerns about more than 90% of women workforce, a topic that one of the few that have not been mentioned in Jacques' presentation. The coverage is a bit limited. There's a quite big coverage gap. The ILO talks about only 30% of the working age population have access to comprehensive social protection. That is not further defined in this World Social Protection Report. But what is much better defined is that only 45% of the world population have access to at least one single social protection benefit. And that's not much, and that changes if we look into developing countries where only a fifth of the whole population has access to one. That is, again, World Bank report, and 2% only have access to social protection. On the right-hand side here on that slide, you can see that OECD observes quite large movements in and out of informality within relatively short periods. They looked for instances in Indonesia and in South Africa and in Peru, and only within 2 to 7 years you have these movements. When it comes to financing, a very small proportion of GDP is spent on social protection, and that if we envisage universal social protection coverage to be changed.
Jürgen, yes. I'm sorry to interrupt, but could you activate your PowerPoint presentation? You are just blocked on the first slide for the moment.
I have not moved to the second now.
Okay, but you should maybe make it in presentation mode.
It is presentation mode.
Not as I can see on the screen, if I may.
Okay, we will check that. I will end the presentation, and I go to the presentation mode once again. It's now on the presentation mode.
Perfect. Okay, thank you very much.
It was on before as well. Good. So coming to the second slide, and I like this picture that has been drawn by Markus Löwe from the German Development Institute 15 years ago, which really shows very nicely what we are talking about in social protection, formal and informal sector. And here again, he presents the missing middle that was mentioned by Jacques before as a very large proportion of the population, and which has really difficulty to access social protection. We have on the top, on the high income, the private insurance, the social insurance, very predominant.
Sorry, Jürgen. Yeah, the presentation is not showing. Sorry to interrupt again.
You have a backup presentation. Can you use yours?
I think I'm going to use. Oh yes. Okay, I'm going to do the presentation for you. It will be easier. Okay.
Yeah, fine. Do that. But then I have to close mine in order to see where you are.
Yes, I'm going to do it immediately. Show my screen.
Sorry for that. That doesn't save time.
Here we are. Okay.
Okay, sorry for the audience. This one we had. Next one, this I have presented. We are here. Good. So there I said that now on the top you have this private insurance and social insurance, where a big problem we see is also civil servants, social protection coverage, which is often non-contributory with very large entitlements and not really linked to the rest of the population. So replacement rates are extremely high, and we see in some budgets that up to 50% of the social protection budget just goes to the very small civil servant sector, and their civil servants, including the Commission, it's also a civil servant organization, has to look on themselves to see that we have not only to change from the informal sector, but also look from the public and formal sector side what needs to be done. Next slide, please. So the challenges faced by many countries, the large gaps which I mentioned, the absence of appropriate risk management, instruments for the informal economy, which makes the workers and their family really vulnerable to income poverty. Women, which are often overrepresented in vulnerable employment, have to be looked at particularly. And children and elderly, as I have mentioned, are quite heavily exposed to informality. The synergies between formal and informal social protection could be strengthened, and this is really an issue where I think that in the future more can be done. And we also consider as one of the challenges a lack of representation of the informal economy in any kind of tripartite social dialogue. It's often said that they are considered as part of the trade unions. They feel themselves more represented by the employers, but it would probably an idea to look in better to move the tripartite arrangements into quadripartite arrangements so that the informal economy can be represented themselves in that kind of political dialogue. The example here given from the OECD study looks at the higher social protection spending, the lower is the informal employment. Data come from the ILO and clearly shows you a low spending in Africa, which 80% informal economy, whereas 20% of GDP in Europe and Central Asia, where the same level more or less is related to people really affected by the informal economy. That might change with this Uberization and Airbnbization, also mentioned by Jacques, that we also see that informal working arrangements in these environments and OECD countries are up to the rise. Next one. This one I will skip. Just look at the headings that what can be done for the improvements, structural changes, conceptual, regulatory, and instrumental innovations, and to make social protection more adaptive to the needs of the different informal workers. That means that design should be changed, access, easier contribution, that it doesn't have to be monthly, annually, that depending on the career and the income generation possibility, contributions can also be done irregularly. All that was perfectly mentioned by Jacques. Next one. The EU responses, and that was the task that I was given. What is the EU doing in working on social protection and social protection to extend for the extension of the informal sector? And I need to start with the policy framework, because we are from the European Commission, as all international organizations and individual governments, bound to our commitments. The most recent and most prominent one in the EU is the new European Consensus on Development. And that one, fortunately, enshrines a clear commitment of the EU and its member states to support efficient, sustainable, and equitable social protection systems that are furthermore affordable, predictable, and financially sustainable as part of the consensus. The consensus reaffirms a right-based approach to social policies, including social protection, and in this way also revalidates the 2012 European Commission's communication on social protection and development cooperation, which was in the same year also adapted by the European Council. Good to know is that similar to before, at least 20% of the ODA of the European Union will be spent on social inclusion and human development, and there's much to be there's much to be expected when we look at future programming. But, and I started here with the but, if we look at the social protection, the development budget, and these figures here shows you the current budget 2014 to 2020 with 55 billion euro, that we just spent 1% on social protection, and 1% of the whole budget, that's really not much. There is a bit more because health and food security, where cash transfers is included, come from different angles, but this is not much, and I would say that we should not expect in the future financial framework that this will happen automatically. If we look at the social protection and humanitarian budgets, we can see that they have quite a higher focus on cash transfers, food security, livelihoods, and but this is a different type of funding, and it is much smaller. We talk in the next financial framework about 7 billion, but here we see that cash transfers reaching the poorest and the most vulnerable in humanitarian funding is much more prominent than in development cooperation. Next one. Next one, please. So what we are doing for that? I have here 2 country examples, and if I look at my watch, I should not go into detail into that. So we support universal health coverage with extension on contributory statutory health insurance to the independent workers in Morocco. There's a budget support program in El Salvador, which focuses on the informal sector. At regional level, the EU is supporting activities by the African Union in collaboration with the ILO, often on capacity building in African Union programs called Spire Work, or the social protection for the informal and rural economy workers. And we have also a small support on migration and mobility dialogue implemented by the ILO, a program on portability of migrant workers' social protection entitlements, which we have clearly included the informal sector. At global level, we have certain kind of global programs which are managed by headquarters in Brussels, like the EU Social Protection Systems Program, Socio Plus, a peer-to-peer facility where support is provided to partner countries' administrations by their peers from European or also South Partnership countries. We have an initiative which is called Social Protection Across the Humanitarian Development Nexus, focusing on the link between humanitarian issues and development to make humanitarian support sustainable for the long term. And we are in the preparation of a new global action program on social protection and public finance management, where we look in particular on budget support and how can social protection improve the achievements of budget support operations in partner countries. Active donor coordination is ensured at global level with the so-called SPRB, which is the Social Protection Interagency Cooperation Board, at EU and partner country level, either with the EU member states and partner country level with donor coordination in collaboration with the partner country itself. Next one. To look in this in more detail, here you see these EU social protection systems initiative where the implementation is done by OECD, Finland, with a parallel funding from Germany. They work in 11 countries. They have quite a good output in publications right now. This program comes to an end. In the middle here, you see the OECD publication funded by this program on social protection and inclusive growth. On the left-hand side, you see the new publication, which is upcoming by the end of the year on tackling vulnerability and informal economy, where I used already some of the figures. Next one. And sorry, just to keep it, just one back, and not to forget, Transform, an initiative of capacity building for non-contributory cash transfers for government and local experts, implemented by this program in collaboration with ILO and UNICEF and the African Union. So next one. For Saussure, next one, directly next one, please. There are some examples I took here too, and the interesting part is if you just look at the general objectives, this is what was the request from the partner country to outline here in Colombia the integrated social protection policy addressing inclusion strategies for workers in the informal economy. So exactly that's what we are talking about. And you see on the activities that starts first with an assessment, limited pilot arrangements in Bogota, consultations with different district entities and municipalities, and now currently and in the next future, a definition of criteria and targeting of income measures and on defining the monitoring framework. These are this short-term support from the peers that I mentioned. Next example. In Cambodia, where you see that the demand was very large to support the extension and strengthening social protection in Cambodia to all non-poor populations. And at the end, it ended up in a small seminar on pensions because it was just impossible for such a facility to work in this regard. But with narrowing down the focus, they have really produced some results. Next one. This is the initiative that I mentioned, social protection across the humanitarian development nexus. I don't want to get further. It really tackles informal economy at large in this difficult scenario, and it's a joint initiative by DEFCO, ECHO, and NEA. Next one. The approaches are systematization, advocating, leveraging synergies, and with this together, orientation towards the Agenda 2030 and the gradual achievement of universal social protection, where we are committed to in collaboration with our global partners, World Bank, ILO, UNICEF, development partners from different member states, the Global Coalition of Social Protection Floors, and other civil society organizations. Next. Yeah, this you can skip, looking at the time. Next one. This is no, but one back. Sorry, this was too quick. Just to give you the idea, this will be a 20 million program on improving the synergies between social protection and public finance management, which we want to implement in collaboration with the ILO, UNICEF. The informal economy will be represented by the Global Coalition of Social Protection Floors, and you will hear about that program in the future, because we are at the end of the time, and I have to stop that we can raise at least answer at least one or two questions. I stop here.
Thank you very much, Jürgen, and thanks a lot. It was very interesting, and yeah, as you said, the time is running, and so I would ask the participants. I think at the beginning, Pierre told you how to raise your hand and ask for a question to Jürgen, to Jacques, or both of them. So if you want to do so, if there is anyone that wants to ask a question now. You have, Pierre, anyone asking questions?
I just want to mention that there were a lot of questions during the presentation.
During the presentation.
I mean, of course, if someone wants to speak now, or taking into account that you need to have a functioning microphone, you can do it. We'll let you a few seconds or to tell us if you want to ask a question. If not, I have already collected some of interesting questions.
Okay, so let's give them like few seconds more to raise the hand if they want to speak. Not really. So maybe Pierre, if there is no one now willing to speak, you can just, since you have collected all the questions asked during the presentation, you can maybe tell us what are the key points, some key points that participants raised, so Jacques and Jürgen can answer. Thank you.
Okay, sorry, there is a little bit of noise outside in the street. I hope it will not be a problem, but basically two main questions, series of questions were asked. One was about, let's say, good practices, which were mentioned during the presentation, and the other were about specific thematic issues. I would suggest to start with the question about the good practices. There were mainly two questions. One was about scaling up, and the other was about what research says about in-cash or in-kind type of action. So just to summarize, one was, okay, you have been talking about in-cash or in-kind, what research says about what is more efficient. And the other was the good practices you have presented. Is it possible? Are they easy to upscale? What are the challenges? What are the barriers to upscale? What can be replicated in other contexts? I don't know who wants to address.
Thank you, Pierre. Maybe, I don't know, Jacques, Jürgen, you want to? Maybe on the good practices, Jacques, you can say something since you presented those, or even Jürgen presented other cases. Your microphone is off.
So about scaling up some of the good practices that have been presented. Well, many of these good practices are supported by international NGOs or social and solidarity economy. And a way of scaling up these good practices is to interfere or to connect with the national institutions. In the case of the National Health Insurance Scheme in Ghana, for instance, of course, the women she-nut producers, they are located in some remote areas in the north of the country, and the action of the NGO in charge of the EU-funded project was to incentivize the officials of the local officials of the NHES in order they come to marketplaces, present the advantage of health coverage, and collect the membership or renew the membership for women producers who had not renewed their membership. And in this sense, the administration of NHES was supported by the project by incentivizing these local officials, by providing them with some motorbikes, for instance, or some computers, and organizing the campaign in the marketplaces, etc. So, of course, this is possible to do for this local administration at the level of the region and even at the level of the the country if some budget is provided for that. So the idea of scaling up is to emphasize and to publicize the results of these local projects in order to try to universalize them at the country level as a good practice. Now, regarding the question about what say research about in-cash or in-kind transfers, well, I have to look at what is said in the research, but I could mention a very interesting article by Banerjee and Esther Duflo, which has been published in Science, and which is a survey on the BRAC action. I mentioned the BRAC, the biggest NGO in the world, in Bangladesh. So BRAC has conducted such cash and in-kind transfers in several countries in the world, especially in Africa. And these two scientists have conducted experimental research in these countries and in this project conducted in the countries by BRAC. And so it is possible to see what is preferable in which case regarding cash and in-kind transfers. But I cannot respond right now with examples.
Thank you, Jacques. Could you please tell us again the names of the authors of these articles for our participants, maybe to...
Banerjee.
Sorry?
Banerjee and Duflo. Well, Duflo is very well known.
Okay, thank you very much.
Who is working at the MIT.
Okay, thanks a lot, Jacques. Jürgen, you have any more?
Yeah, just to add on, concerning scaling up, many of our participants might know that there is quite a big disappointment and the huge expectation of local initiatives that they can scale up at national level or regional level. So I myself, I was involved in the consultation of the Mutuelle de Santé in West Africa in the late 90s when that movement started. And up to today, the mutual organizations of health in West Africa have coverage of less than 10% even if they are big. So these partners are often remaining small partners over decades. So other experience show that so-called partner-agent models together with public institutions like in the Philippines or in India with private insurance, where the whole insurance administration is done by a potential partner, show better results in scaling up. But by and large, what Jacques said, that needs to often have a big donor in the back from either a civil society organization or a bilateral donor in order to have a chance for that. Concerning the research, I reconfirm that the in-cash transfers are very much, there's really a bulk of very good research and research on high quality. A systematic review was published a good year ago by the ODI on experimental research with RCTs on cash transfers, which can be found there. Another very good research on this issue by FAO and UNICEF and the Transform project, which also talks about the uptake of research results and says that it's not only necessary that it is explorative research of good quality, but the results have to come on the right moment in order to be taken up by the politicians and to be implemented. On in-kind transfers, there's much less research, and we are often not really clear what's meant by in-kind. So it's in-kind, the handover of certain assets is in-kind, access to health services, for instances. That is not clear, and there is a terminology also used for that in-kind, which is called cash plus. So the plus can be in-kind service or other consultation services, a huge field, and I invite you for making a webinar on that, because there's many things to say on that.
Thank you very much, Jürgen. So now, since it's already 10 past noon, I think we can close here the webinar. We have a lot of other questions, and before closing, we are going to publish on our Capacity for Dev group. We have a community of practices called IESF, Informal Economy Support Facility. And we have already collected questions, and if you want to ask more questions, of course, you're more welcome to do that. And we will revert the question to Jürgen and Jacques for answers, and in few days you will have the answers on our group hosted on Capacity for Dev. Maybe Pierre, you want to add something?
I mean, first of all, I apologize to all the person who have asked question. We had also a few person who have raised their hand in the meantime, but I understand there is no more time, so I invite them to ask directly the question to me. I will collect them, and then we will, as you mentioned, we will publish them on our website, the website of our Committee of Practice. I just wanted to highlight that you are welcome to join our Committee of Practice, the ISF group on Capacity for Dev, the EU platform for development. I will circulate an email, and you will be provided with a link. You can also follow us, of course, on social media, Facebook, Twitter, LinkedIn. And I also would like to announce that there will be 2 other webinars in the 2 coming months. You can see there already on the screen the topics. You can there will be also links for circulated, so that you can follow up and already register for the next webinars. And we hope that you enjoyed this webinar, and we look forward to seeing you at the 2 next ones.
Thank you, Pierre. Thank you, Jürgen and Jacques, and thank you everybody for attending this webinar. Goodbye. Goodbye. Bye-bye.
Goodbye, everyone.
Bye.
Goodbye.
Bye.